What is focal epilepsy and focal seizures? So, focal epilepsy and focal seizures is that seizure type when seizure starts from one spot in the brain or multiple spots in the brain in a distinct area, and then it can spread to other areas. They used to be called simple partial or partial epilepsy and partial seizures, and now the new terminology is focal epilepsy and focal seizures. So, here's what happens. Focal seizures, the electricity sparks in one area of the brain, and then it starts to propagate, means it moves to other areas of the brain, and then it will cause symptoms. So wherever the seizure starts in the brain, that will be the symptoms. So for example, if the area of the brain is responsible for moving the face and the mouth, the seizure will start by twitching the face like this, and then it will spread to other areas, and like it will go to the shoulder area, it will twitch the shoulder and the face, and then the arm, and then the whole arm. And if the seizure progresses and spreads, it can spread to the whole body and cause whole generalized seizure. So the onset of the seizure, the beginning of the seizure, is what determines if the seizure is focal or generalized. And the way to diagnose focal epilepsy and focal seizures is looking at the video of the seizures. If you record your seizures and the description of the seizure itself, if it starts in one area of the brain, like you turn your head or feel the aura of the seizures, then it is likely a focal seizures. And the focal seizures can be contained and stay in its own place, and the brain will be successful in containing the seizure, so it will be focal seizures. And if you are still aware and during the seizure, it's called focal aware seizure. It can be just a twitch or shaking with you intact awareness. And if the seizure continues to impair the awareness, so it will be focal impaired awareness seizure, or used to be called complex partial seizure. And then, if the seizure starts in one area, start to propagate and move, and then it will spread throughout the brain and shake all over, it would be called focal to bilateral generalized tonic-clonic seizure. So it is important to understand how the seizures is classified, because the treatment is important. So what causes focal epilepsy and focal seizures? Usually the cause of focal seizure and focal epilepsy is there is a one spot in the brain that has a scar, or like a stroke, tumor, traumatic brain injury, or sometimes in the womb, the neuronal cells and the brain cells do not form correctly, and then it will cause issues in that area, and that can lead to seizures in the future and be focal seizure. We can also diagnose focal epilepsy by doing an EEG, and in the EEG, a brainwave test, we can see one single spot that sparks electricity in the brain, and we can diagnose focal epilepsy. And it is important to look at the brain by doing a brain MRI that is hopefully to be specific for epilepsy by epilepsy protocol MRI and read by an experienced neuroradiologist. All right, and how can we treat focal epilepsy? Well, luckily, all the anti-seizure medications work for focal epilepsy and focal seizures. So any anti-seizure from the 31 anti-seizure medications that we have can treat focal epilepsy. And the way we choose which medicine to give to the patient is by the background of the patient, and if there is any other conditions that we can treat together. So if somebody has depression and anxiety, we should not give them levetiracetam or Keppra, because Keppra can worsen depression and anxiety. And if somebody has depression and anxiety, you can give them lamotrigine or Lamictal, which can treat epilepsy and treat the depression and anxiety. So it is important to know the background of the patient before starting the seizure medications. And to learn more about how the seizures will look like, there are so many different types of seizures and epilepsy, not just the shaking all over. You can see this video when I detailed all the types of seizures and epilepsy. And stay healthy, and see you in the next one. Salam.